So I arrive on scene, and the scene is a backyard of someone's house. I have my proper BSI on, and the scene is safe. This is my only patient, and since my scene is safe, I'm not going to call for additional resources at the moment. But my general impression is about 30-year-old man who seems to have fallen from a ladder that he was working on. He is conscious, so he is alert, but I do not know if he is oriented yet. But since he has fallen from a substantial height, around 30 feet, the mechanism of injury is severe. So I'm gonna have my partner maintain C-spine stabilization, and now I'm going to call for additional resources. So I'm going to approach my patient. Sir, can you hear me? Patient informs me that he fell from a 30-foot ladder that he was working on. My patient is responsive to me, but only to verbal stimuli. So I'm going to be giving him a V on the AVHU scale. And so my patient's going to be priority 1 because they have altered level of consciousness. Now I'm going to assess my ABCs. The airway is open and adequate. And now I'm going to assess his breathing. But he seems to have fallen on a screwdriver, so there's an impaled screwdriver in his chest, which is a life threat. So I'm going to treat that first by stabilizing it, and then I'm going to continue my ABCs. So I'm going to administer him on 14 liters on a nasal cannula to help with that. I'm going to assess his circulation. So when I tapped on him, I felt that his skin was pink, dry and warm, and he does have a pulse. And besides the impaled object, there's no other bleeding that I can tell. So since it's a significant MOI, I'm going to be doing a rapid trauma assessment. And while I'm doing the assessment, my partner is going to try to take some sample and OPQRST history. I'm going to start with the head, DCAT BTLS, looking for deformities, contusions, abrasions, lacerations, punctures, tenderness, and swelling. So now I'm going down to his neck, and the airway was open because he was talking to me, and I saw it in my ABCs, but I'm going to check for tracheal deviation and jugular vein distension and DCAT BTLS. Now I'm going to be going down to the chest, palpating the chest, but not on the side with the impaled object. And then I'm going to go palpate the abdomen in each quadrant for DCAT BTLS and rigidity, tenderness, any deformities. Then I'm going to be going to the pelvis and going to the symphysis, and then on the sides down and in, and check for priapism. Then I'm going to be doing DCAT BTLS on the lower extremities, then the upper extremities. And since my partner is maintaining C-spine, we're gonna put a C-spine collar on him and stabilize him to a long backboard. And as me and my partner are log rolling him onto the backboard, I'm going to do a sweep of the back to check for any bleeding and spinal step off. And then priority is still One, because an altered level of consciousness, so I'm going to transport my patient, and en route, I'm going to recheck my stabilization of the impaled object and reassess every 5 minutes vital signs, and reassess my toe assessment and reassess the more severe areas like his head and neck and chest while I'm en route to the hospital.